Queen Clinic waa xarun lagu baaro laguna daweeyo cudurrada haweenka. Xaruntan waxaa kuugu diyaara Dr. Ahmed Ismail oo ah dhakhtar khabiir ku ah kuna takhasusay cudurrada haweenka iyo kobcinta taranka haweenka. Waxaanu u shaqeynayay in ka badan 32 sano. Xaruntan waxaad ka helaysaa adeegyadan cudurrada haweenka iyo la socodka xaaladda haweenka uurka leh. Ilma raadinta Ilaahay baa bixiye. Baarista iyo daaweynta cudurrada galmada lagu kala qaado. Sixitaanka caado wareerka. kala korinta caruurta family planning waxaad kaloo xaruntan ka helaysaa qaliinka qurxinta haweenka female cosmetic surgery.
Bismillah ar-Rahman ar-Rahim. We are Queen's Clinic in 96 Harley Street. Just give you a brief about what we normally do for our patients, which obviously we are targeting a Somali patient in this particular interview. We have been treating Somalis from as early as early 1980s, i.e. almost over 35 years. The prime task of our business here in Queen's Clinic is women health care. The women health care is starting from all the fertility aspects, like women who's trying to have a baby, men trying to have a baby. So we treat both men and women. Also for women who has been pregnant and trying to have a baby, but unfortunately they fail to get pregnant, or they got pregnant but they had several miscarriages. So we treat that type of patients. So i.e. from the maternity point of view, we look after women who is pregnant and also women with a history of a high-risk pregnancy, i.e. blood pressure in pregnancy, diabetes in pregnancy, problems which can affect the mother or the baby in the progress of pregnancy. Women who have traumatic delivery, i.e. delivery with uncomfortable way, i.e. cesarean sections for unknown reasons or for emergency reasons. They want to know whether they're going to have it again or not. Some people, they are not very happy about their experience on the previous deliveries. That is where we are here to give the ultimate answer to their questions. Then after the maternity sections, obviously we treat women from sexual health problems, sexual transmitted diseases, inability to enjoy the relationship, either for female or for men. And then we will target that in a minute. Also we have breast problems. Women sometimes they do have breast lumps, or they have some cysts or some discharge from the nipples, whether it is milky discharge or not. All that must be addressed and must be seen for and examined, and sometimes we do scans to make sure that there is nothing serious within the breast and that can endanger the woman's life. Then we talk about the family planning and the methods of family planning, whether the woman can have a baby when she wanted to have a baby. And if she doesn't want to have a baby, she must use the appropriate methods of contraception and family planning. Also, we do here insist on doing an early detection of cancers, particularly cancer cervix, by using a smear regularly once a year. I know the health service do it once every 3 years, which we're totally against that. We normally like to have it done once a year, and that is very important. Also, in addition to the smear test, we do a human papilloma virus test. This is a very important test, which should go alongside the smear test. Doing this, the human papilloma virus will tell us whether this woman has, or this patient has, a high risk viruses which can lead to cancer cervix. If she doesn't have any high risk viruses, we can give them a vaccine to protect them against cancer. So we have here a vaccine to protect women against cancer. This is very, very important for most of the Somali community to be aware of. Obviously, the earlier the patients can take it, as young age as 9 or 10, female, she can have the vaccine and then would be protected when she get married. But if she got married and she is still having a normal cytology, i.e. smear test, as well as normal human papillomavirus, no viruses, she would be as good as a young girl of 9 to 13, so she can have the vaccine. All in all, we are here as a leaders in women's health care. We have the full knowledge about the Somali community. We know what is their problems. We know also from our experience they are very clean. Miss Angelina can also address that. Looking at the microscope regularly, we do find that majority of the female, they are clean. They don't have a lot of infections, but doesn't mean because they are clean and they don't have lots of infection, that means they do not have a regular checkup. They must have an annual, once a year, a checkup to see 4 major organs: the cervix, uterus, ovaries, and breast. These 4 major organs are the prime reasons for female death in the world. So if the woman is treated early from any problems in these 4 organs, she will end safely and she can live long life and long healthy life, which we are after. Having said that, now in my view, a female Somali must listen to me very carefully, because I treat them as a member of their family. Female circumcision is a disaster, has been a disaster for the young girls, and I would advise strongly to avoid any female circumcision. No matter what's happening, we must advise against that. Number 2, we need also to find out from the females who has had circumcisions their problems. They must come forward. We know that sometimes they have a very difficult intercourse, very difficult, painful intercourse. They must come forward. We can help them. Sometimes they have a recurrent laceration, cuts in the area, and they are so embarrassed to talk to anybody. They must come forward. Sometimes the shape of the area, the private region, is totally distorted, affected, doesn't look pleasant. They are not happy with it. They must come forward, because we do something called a reconstruction of pelvic surgery, reconstructive pelvic surgery, vaginal surgery, i.e. a cosmetic surgery. Cosmetic, we try to make it as close to the nature as possible, as close as possible to when they have had, before they have had the circumcision. A circumcision, as you know, it does cause another major problems. Major problems, and I'm going to be frank with you and open with you. Loss of interest. Women has got major problems. Majority of the female has got problems with loss of interest. They have no interest because the private part has been battered, has been amputated, and the sensitive area has been amputated. Obviously, these female need help because they cannot enjoy the relationship. Their husband also feel it. Sometimes the discussion between husband and wife doesn't take place to the point that a divorce takes place recurrent marriage, searching for some enjoyment, not because they want to leave each other, because they are failing to reach their ultimate enjoyment of relationship. This is also an area of a great interest, which we are here to help the women from Somali community. I am happy to address the subjects. I'm happy to receive the patients. I'm happy to look after the patients. And another area of importance, don't forget women over age of 50, not to be neglected. Women over 50, they can have a hormone replacement therapy. They can be as young as 20 again, not because we are magicians, but because we look at the ovary which stopped working when they are around 50, sometimes earlier than 50, and then they start having hot flushes. Sometimes they have pain, aches all over the body. Sometimes they feel depressed and anxiety. Sometimes they feel loss of interests in the surrounding. They don't want to go out. They are crying. All that is due to the lack of certain hormones as a result of the menopause. Therefore, these women, they must come forward, because the complication of menopause, if they are not treated, they can have the bone broken easily, called osteoporosis. They can have easily saggy breast, skin start wrinkles, looking aging very quickly, aches and pain, hot flushes, heart attack. All these are factors which we can help women by giving them hormone replacement therapy. But before we give hormone replacement therapy, we must make sure that they don't have any foci or any centers in her body of cancer cells, say in breast, ovaries, uterus, cervix. We must exclude that before we subject women to hormone replacement therapy. It's always a pleasure to look after Somali patients. Always welcome all the Somali community, and I look forward very much to see you all healthy, well, and all the families across Britain and across Europe, all in good health. And we are here to help. Thank you. Assalamu alaikum wa rahmatullahi wa barakatuh.